Hi, Tanya.
Hi, Catherine.
All right, so we're going to start this interview. So tell us, what is your background?
Okay, I studied medicine at the University of Witwatersrand in Johannesburg back in the 80s. I then worked for about 15 years for Anglo America and Anglo Gold, big mining companies, as a mine medical officer. During that time, I learned a lot about infectious diseases and occupational health. And I've worked a lot in primary healthcare settings as well. I then retired at a young age to look after my children. Now they've both left home, and I was looking for something that would bring me back into medicine, but in a meaningful way.
Okay. So why did you decide to participate in the Foundations program?
The message that I had received from a number of sources, not just the website, but also speaking to Professor John Gear, just resonated with the vision I had for myself and what I could possibly bring to the program, which basically would involve teaching students.
And you love the bush. I mean, this looked like it would be somewhere that you would want to spend your time in because of the bush and...
Definitely. It's a big draw card, very big draw card, to see the beautiful setting and the absolute luxury of being able to stay in accommodation like this while spending your day at a hospital or in a clinic or teaching. To be able to come back to a home like this is a sanctuary, and it is lovely.
Wonderful. And the expectation versus the reality of when you arrived in regards to the lodge, the clinics, and relating to the staff and patients?
I had I think my expectations were probably met and exceeded. To a large extent, I didn't really know what to expect from the hospital and the clinical setting, because it's very much a case when you're volunteering in a program like this that you need to be adaptable. You need to find out what the needs are when you get there, and you can't be too rigid about it. So the first few days was fitting in, getting to know the students, and I'm talking mainly about the clinical associates. The third year students studying towards their degree in Bachelor of Clinical Medical Practice, and working out from there how I could best contribute towards while I was here towards their learning program. And that turned out to be mainly helping them with clinical skills, helping them with basic examinations of patients, of observations, as well as doing some formal teaching, always in a very informal setting, but in a way that it is in a lecture format, but interactive and very much guided by what they were looking for. At the same time, I also spent 2 days with Dr. John Gear at the Pawana Clinic, and that was hugely rewarding as well.
Wonderful. What was something that you experienced that you had not expected to prior to your visit? Was there anything that came up that you experienced that was completely unexpected?
For me, it was the way that the different doctors, different volunteers, and the healthcare workers, not just limited to doctors, that have been part of this program and that were volunteering, were able to easily exchange ideas. And although we had completely different roles in the program, there was a continuity, and it was great to come back in the afternoons and the evenings and share these experiences with each other. And sometimes we gave each other tips and clues of what could be done to assist the program in our different fields.
Wonderful. Did you face any obstacles? And if so, how did you overcome them?
I think probably my own fear of getting back into the saddle, so to speak. I haven't been practicing actively for a number of years, but seeing that I was more in a teaching role, the days that I did spend at the clinic and seeing patients as a doctor just came back so quickly and easily. I really enjoyed that.
Wonderful. And was there anything that stood out for you? A moment or the whole experience, anything in a nutshell? Did anything what stood out for you?
Two things.
Okay.
One is work related, or the experience of being involved with Tinswalo Hospital, and the other one was completely separate, but I'll talk about both of them. And the first one is just I'm really astounded at how enthusiastic the students are and how they've immersed themselves in the learning process of Tinswalo. And it's not easy because it is a first level hospital and sometimes the facilities are just not there. Sometimes they have to see patients in situations that they aren't taught in their textbooks or in their lectures. But how they were able to use the skills that they've learnt, not just here, but in the previous 2 years,